All right, I want to turn now to a development over the last several days, a major health alert growing across the country. We're expecting some new numbers today on the flu season. The CDC saying an epidemic has now spread to 36 states. At least 15 children have already died from the virus this season, and it could get a lot worse before it's over. With me now is Dr. Devi of the NYU School of Medicine. The CDC saying last month that the flu shot this season is not a great match for the H3N2, is what this is. So if it wasn't a good match for battling the H3N2, and we know they have to kind of look forward, right, and kind of guess.
Like a weather forecast.
Like a weather forecast, but months ahead. Yeah. What can you do then?
So there are a couple of things you can do. I mean, the flu vaccine is still pretty effective. It's not that it's completely ineffective. It has about a 50% chance of protecting you. So if you think about all the missed cases of flu where people didn't get the vaccine and they got sick, we can still make a lot of headway there and prevent people from getting the other types.
50-50.
Well, 50-50 makes it sound like chance, but 50% is more like if you're going into battle and you have armor, if you just have the top half or the bottom half. So it's a little bit better than chance. Now, the other thing is if people have symptoms right away, you know, if they go see their doctor or if they even carry something, an antiviral medication, that can protect them as well. Now, we don't usually use those because the vaccine has been so effective, but these antivirals can actually be very effective at preventing complications if you take them early enough.
All right, to that point then here, doctor, is at what point do you go see the doctor?
Exactly. Well, if you're someone who has asthma or you have kidney problems, liver problems, heart problems, anything else that your body might be fighting or anything else that might affect your immune system, it's worth having a plan even before you develop any symptoms. Why not have these things in place? And otherwise, if you start developing any types of cold symptoms or that feeling like suddenly you've been hit by a truck, then immediately go see the doctor and try to get one of these. Now, one other thing we had talked about is that, you know, epidemic, what do we have to take from that?
Well, the point there is that, and we can pull up that visual again, when you hear the word epidemic, I mean, that's a pretty heavy word.
Yeah, exactly.
And it's covering all these states that we're seeing here. And of course, there's an unfortunate loss of life, the children that have died.
Yeah, so we have to be concerned. There are deaths and there are preventable deaths as well, right? But the word epidemic, actually, the way it's defined is you look at how many deaths are caused by flu-related complications as opposed to other causes. So there are two ways of reaching an epidemic level. You could either have more deaths from complications or you could be effective in preventing other deaths, right? So it's hard to really gauge what this means relatively. We have to look compared to previous years. We have more hospitalizations, that's true,
What is that ratio?
It's 6.8%.
6.8%. So if 6.8% of deaths are related to the flu, then it's an epidemic.
Exactly.
So it's a very low number.
Yeah, it's
I mean, excuse me, by percentage, I want to be very clear.
Yeah, and because it's a percentage, there are a lot of things that can affect it, right? So we have to be careful exactly what we interpret with the word epidemic, but I do think there are a lot of things we can do to prevent this from getting worse, which is, number one, still get the vaccine.
and do what's right to stay healthy. Dr. Devi of the NYU School of Medicine, thank you so much.
Nice to see you.